In this video, I'll discuss my therapeutic approach to acupuncture. As you know, if you follow me, I use a combination of different approaches to acupuncture. My main staples are the balance method and master tongue acupuncture, but I also use a lot of cranial acupuncture such as YNSA, Zhu Scalp Acupuncture and Scalp Acupuncture. And I also use a lot of the knowledge from classical TCM acupuncture. And one of the most common questions I get on almost all my videos is, how do I plan my approach? How do I choose which methods I apply and how do I combine them? I am not a classical balance method practitioner. I'm not a classical master tongue acupuncturist, so I always mix the approaches. But the basis of my work is always a combination of the balance method and master tongue acupuncture, except for neurological cases in which I will start going with YNSA or Zhu Scalp Acupuncture. In my opinion, scalp acupuncture is the best approach when treating neurological problems. In all other cases, I'll generally use a combination of the balance method and master tongue, sprinkling a little bit of scalp acupuncture when I feel it's needed. The first thing I do is the diagnosis part, and for that I will use every resource I have available. So I will do the patient interview, ask every question I think it's important for the case, then I will use every diagnostic tool I have in my tool belt. So I will see the tongue, I will analyze the pulses, sometimes I will do abdominal palpation. If I'm already planning on doing YNSA, for instance, I might do elbow or neck palpation. Sometimes I will incorporate channel palpation from channel theory and the diagnosis from the balance method, so analyzing which channels go through the affected areas to determine also the affected channels. And I will combine all this information to get my diagnosis. Then, for my most common approach, I will use the balance method reasoning, either with a local or global balance, but I won't restrict myself to just the balance method reasoning. So I will incorporate within the balances I'm doing master tongue points, points according to classical TCM theory, and in the end I might even add points from scalp acupuncture techniques. Let's do a clinical case and see how all this plays together. Say I have a patient that arrives at the clinic and he wants to treat acne. He suffers from facial acne, let's say here in the most common areas around the cheeks. I will do my full interview, all the questions I think are relevant to this case. As I told you, I will see the tongue, I will analyze the pulses, I will of course analyze which channels go through the affected area, and let's say, very typical case, I can see that the patient has heat, particularly in the yang ming, and also dampness. It's a very typical case of acne. Typically, if you have heat and dampness, you will also have some stagnation. And using the balance method principles, we can obviously see that the affected channel will be the stomach, maybe with a little bit of large intestine because of the path of the channels and the area where the patient has more acne. So again, this brings us back to the yang ming. After this, what I would do is start designing a global balance, because this is a systemic problem. So if I have the main affected channel as the stomach and I want to treat dampness and heat, I would go to a global balance, something like this. Maybe stomach, spleen, large intestine, and lung. This is a very good balance for a case like this, because you're treating the Yang Ming. You have the spleen, which is very good to treat dampness, and you also have the lung, which is responsible for the skin. As this is a skin problem, it's a very good choice. Then I would need to start thinking about points. So let's start, for instance, here with the stomach channel. If we look at the image, we want to treat the face, so I would look for ashy points in the foot. I might also add stomach 44 because it's very good to clear heat, and as we saw, we had a heat problem in this patient. So maybe along with ashy, use stomach 44. Thinking about Master Tung acupuncture, I would go for the 4 horses. These points are the best Dauma in Master Tung acupuncture to treat the lung, so to treat the skin. And as they are within the stomach channel, I can use them in this global balance without having to do any adjustments. Now let's go to the spleen channel. I might use here the spleen 4 because we know it is very good to treat the stomach and also to clear dampness and heat. I will also look for ashy points around the foot because it is a very good image for the face. Along with this, I might add here spleen 9, and we will see why later on when we get to the lung channel, because there's a very good combination of points we can use which will help us in this case. Continuing, we go for the large intestine channel. In here I would use maybe ashy points around the hand. In here we have Master Tung points Lingu and Dabai. All of them are in the large intestine channel, so they fit within our balance. They are good to promote the flow of qi, which we saw the patient had stagnation, and they are also around the image of the face, so they are very good points to use here. I might also use, for instance, here large intestine 11. According to classical TCM, this is a good point to treat dampness. This is also an excellent point to release heat, which is the main part of our treatment. I might even bleed this point and then needle it. And then we go to the lung channel, and in here again we have the image of the face in the hand. We might think about the points 2201 and 2202 of Master Tung, or just look for ashy points. And I would also add lung 5, and this is because the combination of lung 5 and spleen 9 is a combination from Wang Juyi, the creator of the applied channel theory, and this is, in my opinion, the best combination to move qi. So with this we want to clear the stagnation and strengthen the lung, which is responsible for the skin. So with a treatment like this, as you could see, we incorporate the principles of the balance method, we incorporate the principles of Master Tung acupuncture and the principles of classical TCM. And this is a typical approach for me when treating any kind of illness. So let's say that after we do our diagnosis, the patient goes to the table, we place all the needles we wanted to, and the patient remembers, oh, I forgot to tell you, but I also have some kind of pain here on my right side. Let's say the patient has pain on his hip. You forgot to tell us. This is very common to happen in the clinic. We go to identify where the pain is, and we see it's in his right gallbladder channel. It would be hard to treat the gallbladder without ruining the balance we already designed or without adding a lot of points. So what I might do here is resort to scalp acupuncture. This way I don't have to add any more needles to his body. I don't have to add any more needles to the 12 channels, which are the important part for the balance method, and I can still help the patient and relieve that symptom. So I would go to his head, and as we saw, the problem is in his right hip. In this case, I might go to the left side and use Shunfa's sensory line in the area of the leg, which will treat pain. If the symptom was still there, or if I wanted to cover all my bases, I might also use Yamamoto New Scalp Acupuncture. In this case, I would have to go on the right side and needle maybe the isomatotome. So I have here the line of the leg, and I would go to the bases of the leg to treat the hip. And like this, I could treat the symptom of pain without having to complicate the balance I was already doing for his acne problem. And this is my approach and how I combine all the different techniques I like to use. If you like this video, don't forget to like and subscribe. Also, if you want to learn more about the balance method, check out the course I have in the description. Right now the course is Portuguese only, but very soon I will have the English version available as well.